An induction is not just a different way to start labor. It can completely change how your entire birth experience goes, including increasing risks. So today we're going to talk about everything we want you to know about an induction, ideally before you're being told that you need one, because usually when a woman is told she needs an induction, she often feels like she doesn't have a choice. She just needs to do what she's being told and, trust her doctor, which is the ideal scenario. But unfortunately, inductions are overdone and often done when they're not medically necessary. So we want you to know all of this information now, in case you end up in the pretty high percentage of women who get told that they need an induction, but you don't actually need an induction. I want you to know all about that. So I'm Rachel Moises from the Mighty Mama Movement, a mother of 8, and I'm here with...
I'm Heather, and I'm a family nurse practitioner and midwife.
So we want to start out and explain why we, generally speaking, try to help our moms avoid an induction.
Right. So we want to avoid an induction as much as possible because it usually means for a longer labor. We're forcing the body to do something that it wasn't quite ready to do. And for a first-time mom, that can be much more risky than, let's say, a mom of 8. A mom of 8, the body remembers. It's like riding a bike, and you are not as prone to as many complications. Where a first-time mom, you're trying to teach the body what to do and coax it along without it being ready. So first-time mom labor inductions typically last longer. They require more interventions. More interventions can mean more risks.
So one thing that you need to understand is that the process of giving birth has a whole lot of pretty incredible, facets to it.
It's like a hormonal dance.
Yeah, and it's a process. And when you go into labor naturally, your body is designed to do that in some kind of a step-by-step path. And it knows what it's doing, and it goes through this process, and it's so much easier because your body is taking care of it and your body's doing what it's supposed to be doing to get your baby out. Induction sort of says, have a contraction. Have another one. Okay, more contractions. But your whole body isn't really on board yet with the idea of, we're in labor here, let's do the whole labor thing, right?
With labor, it's not just the woman's body that decides to go into labor. The baby actually sends off a chemical hormone that says, I'm ready, let's go into labor. And so when we induce, we're cutting baby out of that equation. And that can be a really important part of all this.
Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learn these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you will be so glad you did. So I sometimes get called out for using the term natural birth. A lot of people have the position that any birth is a natural birth, and I think that's an interesting position to have because there is a difference between natural and unnatural. So from my perspective, a medical induction is not a natural birth, okay? I had 3 medical inductions and I did give birth unmedicated. I didn't have an epidural, but I don't consider those to have been natural births because I used drugs to force my body into labor.
Right.
And natural birth you'll hear me say it all the time, is so much easier than an unnatural birth. Personally, I have had some natural inductions, and that's a different story, but that's just not very common. And so we're really not even talking about that here, because when you talk about induction, very few women actually had the good fortune to have a provider who helped them with a natural induction, right?
Right. And a natural induction, some people say there is no such thing as a natural induction, just like the natural childbirth, it's all natural. But a natural induction is things that we do to kind of push the body, say, are you ready? Are you ready? Let's give you that encouragement. And natural inductions don't work if the body and the baby aren't ready. And that's why we're not talking about those right now, because the majority of women that get induced are in the hospital. They're getting induced with Pitocin, Cytotec, Cervidil, Foley catheters, basically a lot of interventions that force the body and mimic the hormones that would be naturally created. And that's part of the problem. Those hormones don't cross the blood-brain barrier and give the natural endorphin pain relief that natural oxytocin has. And one thing with inductions as well is you need to look at the risk versus the benefit. If the benefit is, I'm tired of being pregnant, I'm done, I want my baby out.
Very understandable.
Definitely, been there, wanted that baby out. But is that worth the risk of the artificial hormones and the induction and pushing baby and the longer labor that it can create and everything? Where
the trauma that it can bring.
Definitely.
I mean, unfortunately, a lot of traumatic births start with an induction.
Exactly. It's the cascade of interventions that is talked about compared to, let's say, a mom with high blood pressure that is critically high, that now for her to be pregnant is more risky than an induction. Then you want to do the induction. And yes, there are still risks to it, but the risks are less than her staying pregnant.
Right.
And you just have to learn how to work around the induction, work through the induction to get the best experience that you can. But it is still necessary. So,
yeah, okay. So I want to point that out a little bit more. We're from the Mighty Mama movement. We have a birth education program called How to Give Birth with Practically No Pain. And we have had a lot of mamas come to us after their induction births and say, I still had a practically pain-free birth. So we don't want to scare you. Like, there are situations where you're going to need to be induced, and we're going to talk about in a minute how to determine if that's the case. You can still have a positive birth experience if you have to be induced. It's just easier if you don't have to be induced.
Exactly.
Okay. So let's talk about that. If your doctor says, we need to induce you, how are you supposed to handle that to find out if they're doing it because for their own convenience or for something that's not medically necessary, versus if it is something that you, like you said, the risks of staying pregnant are higher than the risks of an induction?
Exactly. So some of the common misconceptions or reasons, I guess you could say, that doctors or midwives will say we need to induce you is, one, you're 39 weeks. So you can be induced because you're 39 weeks. Let's just schedule it.
You're far enough along. You want to get induced?
Exactly.
Like that.
They say baby's too big. This is rarely the case unless you've had gestational diabetes, type 1 diabetes, type 2 diabetes. Chances are you're going to grow the baby that you can birth. And ultrasounds can be 2 to 3 pounds off. I cannot tell you, when I was a doula, how many women their doctor said, they did a late ultrasound and they said, this baby is 9 pounds, this baby is 10 pounds, this baby is 11 pounds. You're going to have a shoulder dystocia. It's going to get caught. We're going to have to use vacuum. Let's just go straight to a C-section, or, we need to induce this baby because it's already 8 pounds.
Can't let it get any bigger.
Right. And then they go and they have a 7-pound baby, and if it was a difficult birth, because not all inductions are difficult. Okay. But if it is a difficult birth, which chances are, especially in a first-time mom, it will be more difficult. The trauma that it creates for that woman going, I went through this for a 7-pound baby. Like, you told me my baby was going to be 9 or 10 pounds. I could have waited and gone into labor spontaneously.
Right.
So that's a big one, is baby's too big.
So if your doctor or midwife says, okay, we need to induce you, I think if the first question is why?
Right, exactly.
And if they say, would you like to be induced? Resist the temptation to say yes. Say, well, I would, but not really. But if they're saying, we need to induce you, you got to come in for induction, we're going to schedule it right now. The first question is simply why? And so you just went over some reasons that are not good reasons.
Right.
What are a few legitimate reasons where if they tell you that, sorry, but you got to accept it, and now just do the best you can to still ensure that you have a positive birth experience?
So this one is kind of a yes and no. Okay. And it is, you're overdue. So most doctors are like, you're 41 weeks. You have to have the baby because, the world could end if you don't have your baby. And they are partially correct. Is the mortality rates go up a little bit, the infant mortality rates. They really go up more at 42 weeks. But what we have our moms do is they get an ultrasound. We do non-stress tests twice a week at 41 weeks to make sure that the placenta is still feeding baby, giving baby the nourishment and oxygen it needs, and that baby is still doing well. And because some women go to 44 weeks. I had an aunt that had 3 babies at 44 weeks. This is before they went induction crazy.
They won't let you do that now.
Oh, no. I had an aunt that went to 46 weeks.
Really?
Yes. And
I bet that would have happened to me with all of my babies.
Probably. And so,
because I have had to be induced for most of mine.
Yeah. And so when a woman says, I just don't go into labor, you would go into labor.
I would have eventually gotten that baby out, right?
Exactly. And so you have to, just because you're 41 weeks does not mean you have to have the baby. On the flip side.
But it does mean you have to make sure the baby and the placenta are still healthy enough to be in there.
Exactly. Like, I had a mom once that was 38 weeks. She really wanted to have her baby. I was like, I am not inducing you. You are 37 weeks, So she hit 38 weeks. And I said, all right, I'm going to send you for an ultrasound. We'll make sure baby's doing okay. Everything is going well. And I wouldn't have normally sent a 38-weeker, but because of this mom and her persistence, I was like, okay, let's do this. So I sent her for an ultrasound, and the ultrasound tech called me and she said, you need to get that baby out. That placenta is breaking down. You've got to get that baby out. Mm-hmm. And so that was one that I was like, all right. Luckily, it was her 3rd or 4th baby. And so it went pretty easy peasy. And she had her baby a few hours later. But I would never have done that without the ultrasound tech saying, you've got a problem. Mm-hmm. But on the flip side, I've had women, legally, I can do up to 43 weeks with my license. And I've had women that are perfectly happy waiting till 43 weeks. And I'm like, okay.
As long as everything's safe, great. And we're being very cautious and checking.
Exactly. We watched baby, we watched placenta, we made sure everything was okay every few days to make sure that they were all right. And so you do have to do these things with guidance. So high blood pressure. Now, I remember working at a hospital in Seattle, and the March of Dimes came out with a study, and that's where the 39-week elective induction came in. Mm-hmm. And it took quite a while for doctors to take grasp of this, because they were used to inducing at 38 weeks if they wanted to, because they were going on vacation or they wanted to do it when they were on call from this large practice. And so we would have moms come in the hospital and they'd be 38 weeks and we would be like, we can't induce you. Hospital protocol is you have to be at least 39 weeks unless there is a medical indication. So we would send them home. And then the next day they would show up and the doctor's orders would magically be the mom has high blood pressure. Her blood pressure now is magically, even though yesterday it was 125/74, it's now 145/92, so we can induce. And we just were like,
they were looking for a
false
false justification.
Exactly.
Okay, we had a question come up lately about this, so I want you to explain this. We've talked before about how doctors sometimes want an induction for their own convenience.
Right.
You just said that the doctor wants to deliver the baby while they're on call.
Right.
Do doctors get paid more money for how many deliveries they actually do?
Right.
Or is it just a shared pool among the practice? Let's say it's a
No.
practice with 12 doctors.
They typically get paid for the deliveries they do.
So if they work a shift with more deliveries, then their payout at the end of the month is going to be higher.
Right. So a lot of midwifery practices, they are paid a flat rate no matter if they do a birth when they're on call, or if they do no births, or they do 8 births while they're on call. It's a flat rate. But many doctors' offices, not all, but many doctors' offices, they only get a chunk of the payment if they deliver that baby.
Okay, so that's good to point out, because we have had people make comments that, well, my doctor doesn't care because, you know, it's that practice or whoever's on call just delivers the baby, so it doesn't really matter, so they're not really inducing for convenience. But if this is the case in a practice, then maybe they are. They're just not explaining that to you.
Right. So yeah, that can definitely make a difference with many practices. It's kind of like surgeries. They get paid for every gynecological surgery they do. So of course they want to book more of those. Okay. So it's not saying they're not needed, but they don't get just paid a flat rate. They get paid by how much they bring into the hospital.
Okay. Yeah. So that could be a factor. And I mean, the reason we're talking about this is just for you to understand that, yes, sometimes doctors and midwives, we say doctors a lot more because it tends to be a bit more often, I think, among doctors. Maybe.
And like 85% of the births in the country are done by physicians.
Right.
So
they just it's part of being educated, knowing the truth, knowing that sometimes doctors do want to induce because it works with their schedule better, because they want to be the one to deliver the baby, because they're heading out of town and then they're not going to be able to deliver the baby or whatever it is. It does happen. And I think denying that doesn't help anybody.
Right. Another medically necessary reason for induction can be low amniotic fluid levels. So babies will breathe the amniotic fluid, and they practice breathing, and it keeps their lungs from being sticky. You know, they move well, because when they're born, obviously those lungs need to expand, the alveoli open, fluid pushes through the alveoli, and air, you know, we start the oxygen exchange. And when you've had really low amniotic fluid, that can be kind of, they call it like sticky lungs. You know, the lungs don't want to open as well. That can also mean that the placenta is starting to shut down and not function as well. So a low amniotic fluid level index can be a reason for an induction. So we want to look at that. Now, one thing I will say is, I remember I would walk into the hospital for the beginning of my shift. You know, there's the big board on the wall and shows who's in what room and if they're being induced, or, you know, any special circumstances. And I would notice that seriously, 85% of the women on the board were being induced. And I was like, you're telling me every shift I come in that 85% of the women don't know how to go into labor? Like, have to be induced? Like, that's ridiculous. This is crazy. And so really having a good reason, and research ebbs and flows. So now the latest research, which can be manipulated, and I know this has been manipulated, is, it's perfectly fine to have your baby at 39 weeks and the C-section rate doesn't go up and it's actually healthier. And I'm like, there's no way. There's no way. You can manipulate that so many ways to get the answer that you want with that. But with the risks of C-section and the risk of stressing out the baby with Pitocin contractions that can be tetanic, that's just ridiculous.
And there's also the fact that the 40-week mark for gestation is just not applicable to every single pregnancy, and every, it's sort of the middle point. Right. Being overdue doesn't mean your baby's like too done, right? Too developed or something. You know what I mean? Exactly. Your baby can be perfectly healthy and happy and comfy in there and still developing. And some babies' lungs take longer to develop, etc.
So a couple of examples of that. So the 39-week mom that is being induced, if she would have gone naturally to 44 weeks, that is a 5-week premature baby for her. If she'd have naturally gone to 42 weeks, that's a 3-week premature baby for her, earlier than would be. And so looking at that, I have all my babies at 38 weeks. 38 weeks comes, my baby spits them out, okay? And my first baby, that was probably about right for him. My second baby, every sign showed that he was over 40 weeks. I know for a fact when that child was conceived, and he was not 40 weeks, he was 38 weeks, but that same child grew
developed
faster. He did, because his older brother is like 5'8", he is 6'6". So obviously he was a child that developed faster. My last child was 38 weeks. I had a lot of health issues. And so I did natural things to get her out because my health was so bad. And she went to 38 weeks and 2 days, which is the longest I've ever gone. And she looked like she could have gone another week or two. My body couldn't have gone another week or two. It was done. But she could have. And all of my babies, like I said, were all basically 38 weeks. 2 showed like they were great. 1 showed early and 1 showed late. And I know, like I said, exactly when every single one of them were conceived. And so I know their exact dating. And when you throw that off, it's kind of like you have a 40-weeker that has a 5-pound baby and a 40-weeker that has a 10-pound baby. They're all within normal range. And so we can't, I hate that the medical world puts everyone into this box.
This one date is the date.
Right, exactly. And if you go over, it's the end of the world. And if you go too early, but I've delivered a 35-weeker that was perfectly fine. You know, the hospital sent her home saying, "You're not in labor." She's like, "I'm in labor. Will you check me?" I checked her. She was 10 centimeters. She had her baby. We called the pediatrician and said, "I'm not sending this baby home till you check it out." He checked it out and said, "Looks great, send her home."
Oh.
You know, but someone else having a 35-weeker would have been, and that was spontaneous labor, of course.
Right.
Would have been way, way too early. So we can't, I hate the box that everyone has to fit in perfectly, you know.
Which just goes back to an induction is not natural. And it's deciding that we know better than what our body and nature knows.
Right.
When we don't always. Now, obviously, because of medical advancements, it's really nice that we have inductions and NICUs, because we know sometimes these warning signs and that in days gone by would have led to an emergency or a death of a baby, but now we can handle those and get the baby out and take care of the baby. Okay, we're not against medical advancement and using all of the things that we have to keep mom and baby safe. The problem is, like what Heather was saying, when 85% of the babies are being induced or the labors are being induced, there's no way that's necessary.
Right.
Certainly not
statistically
working with nature. And so that's where we're saying, if you are being told that you need to be induced, think about that, ask why, figure out if it's a medical need, which it is sometimes, but I don't know what the exact statistic is. I doubt anyone does, because they say so many are necessary when they're not actually necessary.
Right.
And then the other thing we want to talk about, if they tell you, for example, well, the amniotic fluid is too low or whatever, there is a medical need, whatever they say the need is for medical. One question you can ask is, okay, so I understand we do have this problem, we have to handle it. You can ask, are there any alternatives we could try first? And sometimes there might be, and sometimes there might not be. Do you want to talk to us about that?
Yeah. So an interesting story I have about that is I had a woman who came to me, I'm thinking it was about her 4th or 5th baby, that she had a birth center birth with me. And then her next pregnancy, she had hypertension from the beginning of pregnancy. And so she ended up having to have care with an OB to monitor her blood pressure and keep it under control. So it came time that she needed to be induced because of her blood pressure issues that they really struggled to keep under control. Very healthy woman, but high blood pressure for some reason. And so she didn't want to do the typical Pitocin induction, that whole thing. And so she asked her doctor, she said, "Can I please go to my midwife, have her get me started. And once labor gets going, I promise to come into the hospital for the health of me and my baby and have have my baby in the hospital where you can monitor my blood pressure. And he was like, that's fine. So she needed antibiotics. She was group B strep positive and she wanted those. So her doctor wrote her a prescription for the antibiotics, and she brought those to the birth center, and I, gave her the antibiotics because she has fast labors as well.
Mm-hmm.
So we had to get those antibiotics started, that first dose, because they want 2 doses. And then I did some natural techniques that I knew would work with her. We got labor going. As soon as she got into a consistent labor pattern, she went to the hospital and was able to have her baby. And it was wonderful that the doctor didn't say, no, I'm sorry, you can't do that. That's too risky. I want to monitor you the whole time. He was like, just promise me you'll come in once you have an established labor pattern.
Mm-hmm.
And she did. And it was great because she was able to avoid Pitocin, avoid any of those artificial hormones. And for her, she felt like she had a great experience.
Okay. Let's say that the amniotic fluid is low. Is it possible to hydrate a whole bunch and get it up?
You can definitely try that. So I always have moms do that first. If they have low amniotic fluid, now typically medical hospital providers will just say, oh, we've got to, get the baby out.
Straight for an induction right now.
Where I will have them, as long as baby's non-stress test, their heart is sounding good, then I have them go home. I have them drink a lot of fluids, not just water, but a bit of electrolytes mixed in there. I know this sounds weird, but I have them do Jello, maybe not brand name Jello because of the dyes and the preservatives and stuff, but gelatin.
Mm-hmm.
I have them drink like gelatin as well because that has shown that it can increase the amniotic fluid level. Mm. So is it going to take it from a 4 to a 20? No, it will just bump it up a few points. Mm-hmm. But sometimes those few points, and if mom was dehydrated, it can correct itself. Now, if it's a placenta issue, it's not going to correct itself, mm-hmm. and we need to get baby out. Mm-hmm. But if it is just a dehydration issue, mom just hasn't been very good at drinking, then I will have her do the gelatin. I heard many midwives say that stevia increases the amniotic fluid level, so I'll have them make like a lemonade with stevia and drink a lot of those fluids. And most of the time, I've been able to see the levels come up long enough that we can wait for her to naturally go into labor.
That's interesting.
So, yeah.
Okay, so talk to your provider about any alternative options if they do feel that there's a medical necessity. And then we touched on this, but I just want to reiterate. If you do have to be induced, we're not trying to scare you. It's still possible to have a good birth experience. If you're watching this early enough in your pregnancy that you haven't just been told you have to be induced, prepare for your birth because, like I said, women who go through our program oftentimes have positive induction experiences, and they're so excited because even though they had to be induced, they still had a low pain, comfortable, nice birth experience. But you want to do that preparation before you're being told you need to be induced.
Definitely.
And then if you are being told you need to be induced, we just want you to understand you might not need to be induced. And so that's where learn what we're talking about here. Go back and watch this video again. Like, make sure you understand the process. And don't buy into the narrative that an induction is just routine, no big deal, nothing to think twice about. Because I think that is really the attitude that most medical providers have, is just, right. There's no risk involved. There's nothing to think about here. Induction's great. Want to get an induction? Sure, get an induction. Let's do an induction. Inductions are fun. I've had 3 medical inductions, and I'll tell you, they're not as fun as a natural birth.
Oh, yeah. Yeah.
I mean, after I just told you can still have a good birth, I wasn't prepared for those births, I will say. Those medical inductions, I wasn't educated. I didn't know the things that we teach in the Mighty Mama movement. And so that's where I'm pretty passionate about that, is that getting a medical induction without birth preparation and without knowing strategies and techniques to lower the pain, you do not want that. Like, believe me, you don't want that experience. So either avoid the induction or get prepared for it in case you might need it, because you never know. Anyone might need an induction.
Exactly.
Some of my inductions were medically necessary. Probably really only one was actually 2. 2 were medically necessary. I had 8 babies, 6 of them, well, 5 others were induced, and it wasn't medically necessary. That's the whole story. I'm not telling you my whole story of my inductions, but the point I'm making is Try to avoid it and prepare for it in case it happens.
Exactly.
Did I make that clear enough?
Yes.
I'm very serious about this.
No, I agree. And like my first baby wasn't considered an induction because my water had broken, but I had no contractions at all. And so it was considered an augmentation, but it's still the same steps as an induction. And that birth is why I'm sitting here today, because that birth was, once again, I didn't prepare as well. And I hated it. It was very traumatizing to me. Where my other babies, I had, one of them with a natural induction or that sort of thing. But because I was prepared and my body was trying to go into labor, it was a totally different story. But the preparation was the key, was the absolute key. Because I needed the Pitocin with my first baby, having my water broken and nothing happening for quite a while. But I could have been more prepared had I known how to be more prepared.
And still had a good experience.
Exactly.
Okay.
Exactly.
This information is all critical for you to understand and know. So like I said, watch this video again. Make sure you understand this. This is a very, very common thing for women to face, and you want to be able to handle it in the best way, because that is just going to increase your chances of having a positive birth experience by a lot. And also check out our free birth class, How to Give Birth with Practically No Pain, because that is a really helpful, easy way to prepare for your birth so that whatever ends up happening, you can have a positive, peaceful birth experience.